Hello everyone. So let's start with a very important topic, that is peritoneum. If I want to define peritoneum, it's a serous membrane which is made of simple squamous epithelium and it is lining the walls of abdominal cavity and the pelvic cavity. It covers the organs, and the organs which is completely covered by the peritoneum is called as intraperitoneal organs. Some organs lies posterior to the, having one layer of peritoneum is lying posterior to the peritoneum. That structures are called as, or organs are called as, retroperitoneal structures. Now, in between these two layers of the peritoneum, there is a potential space, and that potential space is called as the peritoneal cavity. Now, it's important for us to know that this peritoneum is containing, this peritoneal cavity is containing the fluid. What is the amount of the serous fluid which lies in this peritoneal cavity? Approximately it is having 50 ml of serous fluid. Now, the peritoneal cavity is derived from the coelomic cavity of the embryo, and it is very important that it contains serous fluid, which is important for the lubrication and for anti-inflammatory properties. It's also important for us to know the basic difference between the parietal and the visceral layer of the peritoneum. So, before proceeding to that topic, I would also like to tell that if you will see a vertical sagittal section and vertical tracing, when you see the vertical tracing of the peritoneum, you can see the general cavity of the whole abdominopelvic cavity, that is called as the greater sac. And there is another space which is considered to be you can say, the diverticulum of the greater sac, which is lying posterior to the stomach, and that space is called as lesser sac. That means the peritoneal cavity is subdivided into greater and the lesser sac. These two sacs communicate with each other via foramen of Winslow. Now, I would just like to show you this image which is showing the vertical tracing of the peritoneum. Now, here in this diagram, you can clearly appreciate this whole space which has been shown by the pink color, this whole cavity or the space which you are seeing here. This whole space is the greater sac. It's the greater sac. Now, just posterior to the stomach, now we can see the another one, this is the stomach, and just posterior to the stomach, in between the greater lesser omentum, as you can see here, here you can see it's lying posterior to the part of greater omentum, that of the stomach, and this space which is outlined as in blue color, that space which is called as the diverticulum of the greater sac, and both of these spaces are communicating via foramen. The name of that foramen is epiploic foramen, which is also called as foramen of Winslow. That means the greater and the lesser sac communication is via foramen of Winslow. The other name is epiploic foramen, as shown in the diagram. Now, let's talk about basic difference between the parietal and visceral layer of peritoneum. So, when you go for dissections and you go for cadaveric dissection, what you will find that it's very easy to remove the parietal peritoneum from the interior of abdominal wall or pelvic cavity. It is loosely attached in comparison to that of the visceral peritoneum, which is adherent to the surface of organs and the viscera. The other important thing which is very important for your MCQ is embryological derivative. So, if I talk about the parietal peritoneum, it is derived from somatopleuric layer of mesoderm, and if I talk about the visceral peritoneum, it is derived from splanchnopluric layer of the mesoderm. So, if you will go for the dissection, as I told you, it's easy to remove the parietal peritoneum as compared to the visceral peritoneum, and the space which contains the serous fluid and which is important for the lubrication of the organs, that space is called as the peritoneal cavity in between the parietal and visceral layer of peritoneum. Now, I would also like to describe folds of peritoneum. Now, what happens? The peritoneum fold is very important, forming many of the ligaments, greater, lesser, omentum and mesentery, which is containing the loops of small intestine, jejunum and ileum. So, one by one we will discuss that. Now, before that, I would also like to tell about which organs are retroperitoneal. Okay, so like if I talk about kidney, suprarenal structures, ureter, they are primarily retroperitoneal structure. Now what happens in the process of development, few of the mesenteries get absorbed, and that structures becomes process of absorption of the peritoneum part is called as zygosis. It's called as zygosis, and these structures are secondarily retroperitoneal. So what is important for us, and it is very important that we should know the list of all the structures which are retroperitoneal. So I would also like to give you the examples of all that structures, and mnemonic is there. Before that, I just want to tell that what do you mean by the term intraperitoneal. When I use the term intraperitoneal, it means the entire organ is covered by the peritoneum. So you can say the peritoneum is forming an envelope for the organ, and such kind of organs are called as, most of the organs are intraperitoneal. The important examples: stomach, liver and spleen. Let's talk about the structures which is retroperitoneal, and it is very important for MCQ that you should know all the retroperitoneal structures in our body. Now, so as I have told you, the same thing has been written here, that primarily retroperitoneal structures means lying outside the parietal peritoneum. The primary retroperitoneal structures are that of the kidney, ureters and suprarenal structures. Secondary retroperitoneal structures are those structures which, by the process of zygosis, the mesentery is absorbed, and then in adult, what happens, the anterior surface, one surface is only covered by the peritoneum, and such kind of structures, organs are called as secondary retroperitoneal organs. So a very important mnemonic is there. I would like everyone to know. The mnemonic is SAD Pakkar. The mnemonic is SAD Pakkar, which is telling you all the structures in our body which is retroperitoneal. So here S stands for suprarenal or adrenal glands. A means abdominal aorta, the great vessels of our body, the abdominal aorta and the IVC, inferior vena cava. The entire of the duodenum except the initial or the proximal part of the duodenum, which is called as the duodenal cap. The whole of the pancreas except the tail, ureters, colons, ascending descending colons, kidneys, rectum, esophagus. So all these structures together are retroperitoneal structures in our body. The mnemonic is SAD Pakkar. Now, okay, other than that, I would also like to show you this diagram. Here what you can appreciate, now we know that developing gut is divided into three parts: foregut, midgut and hindgut. The arterial supply of foregut is by the celiac trunk branches, midgut loop is by superior mesenteric artery, and hindgut loop is by inferior mesenteric artery. Now what happens? Now what you can see here, the intestinal loop, the developing GIT tract has been shown here in the yellow color. Anterior to it lies the ventral mesentery and posterior to it lies the dorsal mesentery. In the ventral mesentery, you can see the liver is developing, and it divides the ventral mesentery into anterior and posterior part, ventral and dorsal part. And for your MCQs, it is very important that you should know the derivatives of ventral mesentery and the derivatives of dorsal mesentery. So, the derivatives of ventral important for MCQ. It's important for MCQ. Wherever an important point comes for MCQs, which is very important for you and you should by heart, is I would like to mark that. Okay, derivatives of ventral mesogastrium are right and the left triangular ligament, which you can appreciate in the liver, superior and inferior coronary ligament, falciform ligament, which is the ligament dividing the liver into anatomical right and the left lobe, the lesser omentum. The lesser omentum is also having two parts, hepatogastric part and hepatoduodenal part. That means hepatogastric ligament and hepatoduodenal ligament. So these are all the derivatives of ventral mesogastrium. Let's talk about the derivatives of dorsal mesogastrium. When I am talking about dorsal mesogastrium, the important derivatives are gastrosplenic ligament, again very important for MCQ, gastrophrenic ligament, linorenal ligament connecting the spleen and the kidney, greater omentum attached to the greater curvature of the stomach. All these are derivatives of dorsal mesogastrium. Now, let's talk about greater omentum. The greater omentum is a fold of peritoneum which is attached to the greater curvature of the stomach as shown in the diagram. Let me just enlarge this. Here you can appreciate this. This is the greater curvature of the stomach, and from here you can see the greater omentum is hanging down, covering the entire organs and protecting the interior organs of the body. Actually, it's like an apron. It's like an apron, as you can see here. When we cut open the abdominal cavity, what we can see the greater omentum, and we have to raise the fold of greater omentum to see the structures inside. The greater omentum is considered to be the policeman of abdominal cavity. The reason is that why it is called as the policeman of abdominal cavity, because it contains macrophages. So if you will see inside the actually it is having a 4 layered structure, and if we see the structures lying inside the greater omentum, in the layer of the greater omentum, it is containing, what does it contains? It is containing adipose tissue, it is containing aggregation of macrophages, so it can engulf all the foreign or any kind of invasion. It can protect the interior of the structure from any kind of infections. Other than that, the greater omentum also contains right and the left gastroepiploic vessels. Now, so if I want to define greater omentum, it consists of 4 layers of the visceral peritoneum. It descends from the greater curvature of the stomach, also the most initial part of the duodenum, and the 2 layers again folds, and it is attached to the interior aspect of transverse colon. And as I told you, its role is lying in the immunity, as it is very importantly containing the aggregations of macrophages, so it is considered to be the abdominal policeman. Now, my dear aspirants, I want everybody to please note down what are the contents of greater omentum. So, I just want you to note down that point. So, please just write this, the content of greater omentum. Here you can write above content. So, if I talk about the content of greater omentum, it contains adipose tissue, that means fat, variable amount of fat. It contains aggregation of macrophages, and it also contains the right and the left gastroepiploic vessel. So, actually it is lying between the layers of the greater omentum, and these arteries are anastomosing. The both side, right and the left arteries are anastomosing. So, it contains right and left gastroepiploic vessels. It contains right and the left gastroepiploic vessels. So, done with this. Now let's talk about the lesser omentum. Okay. Now, if I talk about the lesser omentum, let me slightly enlarge this image where you can appreciate the lesser curvature of the stomach. So, this is the lesser curvature of the stomach, and from the lesser curvature of the stomach and also in the initial part of the duodenum, proximal part of duodenum, we can see the attachment of lesser omentum, which is connecting the stomach with the liver. So, it is superiorly, if you will see, if we talk about the superior attachment of the lesser omentum, so superiorly if we talk about, it is attached to the portahepatic region of the liver along with the fissure of the ligamentum venosum. And lower down inferiorly, it is attached to the lesser curvature of the stomach and the initial part of duodenum. So, exactly this is the lesser omentum. This is the lesser omentum. You can see the free margin of the lesser omentum, you can see there lies the epiploic foramen, which is also called as foramen of Winslow, forming a communication between the greater and the lesser sac of abdomen. Now, I would like to show another image where you can appreciate the lesser omentum, where you can clearly see the attachment. So, here you can see this is the initial part of duodenum, and this is the lesser curvature which is connected to the liver, portahepatic region, and the fissure of ligamentum venosum. And if you will see the diagram nicely, you can appreciate the contents which is lying in the free margin of the lesser omentum, the bile duct, the portal vein, and also the hepatic artery. also the hepatic artery. So these are the three contents which is shown in the free margin of the lesser omentum. So other than that, if I talk about the lesser curvature of the stomach, or the lesser along the lesser curvature of the stomach, if I talk about that, there the content lies is the right and the left gastric vessel.